Greetings, I'm the dentist. Welcome back to DENTAGENDA. This is Chapter 3, Pediatric Dentistry. These are the points included in this chapter, and in this tutorial we will discuss common childhood ailments affecting the mouth and sugar-free medications. And here is the outline. Before we begin, note that you should always refer any patient with an ulcer that doesn't heal within 3 weeks or with any soft tissue lesion of unknown etiology to a specialist as soon as possible. Starting with viral infections. Primary herpetic gingival stomatitis. Usually it occurs older than 6 months of age. Signs and symptoms: fever, cervical lymphadenitis, and the presence of vesicles leading to ulcers on gingiva and oral mucosa. Treatment: you should advise the patient to be on soft diet with plenty of fluids, and it is usually self-limiting. Note that it is more common in primary school age children. Secondary herpes labialis. It is caused by herpes simplex virus. Signs and symptoms: the presence of vesicles around the lips and then they crust. Hand, foot and mouth disease that causes rash on the hands and feet and ulcers on oral mucosa and gingiva, with the presence of little systemic upset. Usually it is self-limiting, just like most viral infections. Hair angina febrile illness. Signs and symptoms: sore throat due to the ulcers on the soft palate and throat. Usually it lasts for about 3 to 5 days. Treatment: soft diet, and note that you should always check the hands for the presence of any warts. And usually it is self-limiting, like most viral infections. Other viral infections that also have oral manifestation include chickenpox, mumps, glandular fever, and measles. Now to the bacterial infections that may have oral manifestation, starting with impetigo. It's a very infectious staphylococcal and or streptococcal rash that starts around the mouth and may be mistaken for secondary herpes. Also, streptococcal sore throat. It can contrast associated streptococcal gingivitis, but it is very, very rare. Also, necrotizing ulcerative gingivitis, but it is rare under the age of 16. Moving on to the fungal infections with oral manifestation, starting with Candida. It is a commensal of the oral cavity that may only become pathologic when oral environment favors its proliferation. It can be seen in newborn and undernourished infants after prolonged use of antibiotics or steroids. Signs: acute pseudomembranous candidiasis or thrush. It is present as a white patch on the oral mucosa and tongue, but these patches can be rubbed off, which differentiates it from other oral white lesions. Treatment is an antifungal medication, and you should always correct the underlying problem. Chronic atrophic candidiasis, most commonly related to poor oral hygiene or high sugar intake. Treatment includes oral hygiene and instructions for the teeth, of course, and for any appliances used. Also, chlorhexidine mouthwash or miconazole gel. Other different oral illnesses may include office ulceration and orofacial granulomatosis. Common causes of oral ulceration in children in order of frequency. Number 1, office ulcers. Number 2, trauma. Number 3, acute herpetic gingival stomatitis. Number 4, hairpin angina. Number 5, hand, foot and mouth disease. And number 6, glandular fever. Common causes of soft tissue swellings in children. Abscess, mucocele, eruption cyst, epulis, and papilloma. Now moving to the sugar-free medications for children. The potential cardiogenic effect of long-term medications sweetened with sugar is now well recognized. Therefore, sugar-free preparations should be prescribed whenever possible. Unfortunately, there is no evidence that rinsing out or brushing the teeth after the use of sugar-based medicine will significantly decrease the incidence of caries. That's why current medical advice is for liquid medicines to be given to children by disposable syringes. This approach has the advantage that an accurate dose can be directed at the back of the mouth, unlike the conventional way. And by this we have covered all the points. Thank you for watching. Don't forget to subscribe. I'd like to have you here for more videos. And follow us on Instagram at DENTAGENDA for extra tips and tricks.